It's a healthy Thursday, but we also have the wellness program coming up later today. Details of that I'll share with you in a bit. Okay, but we have a conversation on the back of that, and we're talking about financing pregnancies. There's a very this is quite new, saving towards pregnancy, financing your pregnancy, very innovative way of doing it. So Dr. Elvis Kumafor-Singh, who is CEO of Service Hub Limited, will join us. They have a product called Trimester Save to help pregnant women save towards their delivery and also acquire health insurance to save them the embarrassment of not being able to settle their bills after delivery. That conversation is coming up on a Healthy Thursday here on the AM show.
Joy Business Van, empowered by Joy Business and supported by EcoBank, the Pan-African Bank. The arrival of this bundle of joy may not necessarily bring happiness to every mother, as bills not covered by the NHIS pile up. For some mothers, they have to spend several days in the hospital without being discharged. The reason is simple: lack of money to settle their bills. We are at the Mamobi Polyclinic, where Rose Tete is attending her antenatal for her third child. She tells me Dr. Forson will this time save her some embarrassment.
So it's like when I was in the labor ward, I have to go, and then the nurses will give me something. Do you have this? I say no. Do you have this? I say no. So they will give me something. Then at the end of the day, when it's time for them to collect their money, I was not having it. So what happened is, when somebody came, maybe somebody comes there to visit me, and they say, oh, okay, take this for this, then I'll use it to support. Take this for this, then I'll use it.
That's embarrassing, isn't it?
Yes.
So you didn't want this embarrassment again?
My dear, that is it.
Insurance and good, but Musan nim say insurance for whole, insurance in the whole. Musan here sika.
Dr. Forson began Trimester Save less than 9 months ago, and the motivation is to save mothers the embarrassment of not being able to settle their bills after delivery, and midwives at the hospital also the frustration of dealing with such patients.
To be honest, this came about as a result of my interaction on the labor wards with midwives, and they are often painted black because they seem to be unaccommodating to pregnant women. But I realized that they actually are not to blame in many of the situations. They are responsible mothers, and they also have their lives to lead, and they suddenly have to manage this patient sometimes at 2 a.m. who have no funds, and some hospitals don't have any arrangement. And it's quite frustrating that a woman was pregnant for 9 months and arrived, as they say, with 10 fingers, with nothing to show. So I think that was my primary motivation, to solve this from the patient and then the midwife's perspective, so that this availability of funds to facilitate the process will be easy.
Africa is the leading continent where patients have to cough up about 40% payment of their bills.
I wouldn't single out Ghana, but I would say Sub-Saharan Africa in general. Out-of-pocket payments can rise up to 40% of the cost of having a child.
The platform makes women save towards their delivery either daily, weekly or monthly till their due date. The money is then saved in a Pan-African savings and loans account where women cannot touch it till after the 9 months.
What we are doing now is we are onboarding the pregnant women onto Quick. And the customers themselves set the target that they want. And then they break this down into how many times they want to save and how much they want to put down. So we lock it, we put it in. So you must deposit that amount towards your delivery. So this will meet your financial requirements at delivery. And what we do is we lock it so that you cannot withdraw, because we want to help them save.
To go to bank, I can't go. Maybe the man is not there. So when I came to the hospital and they introduced this, I noticed and I thought it will help me, because even if I'm in my bedroom, I can withdraw money or do mobile money from it. And if I want to save too, so from now till the time I will give birth, I don't think I will have a problem, because right now when I started, when I check the account, I see I have something there.
So what happened to the NHIS?
So there are inefficiencies everywhere, and I wouldn't want to blame the NHIS necessarily, but even in facilities, there will always be out-of-pocket payments for certain things that NHIS doesn't cover. And as I've also mentioned, there are other costs associated with having children that NHIS can simply not cross into, and so I think that's where our value proposition is, and it is a very real value proposition.
So far, 70 women have signed on to the Trimester Save platform, and it's already making waves around the world.
From Uganda, there has been significant interest. They've been calling to us to come and set it up. I'm Ghanaian. I just wanted to stand in there before East Africa, who is known for all these innovation steps in.
That's right.
There's been some interest from Kenya as well. Then South Africa, for example, is undergoing a big overhaul of their health system. They want to set up insurance, a new national health insurance system. So we've had some interest from there. And from far away India as well, we do have interest.
Startup has already attracted the United Nations attention.
UNCDF is the United Nations Capital Development Fund. What it focuses on is to make public and private capital work for the poor. And how do we do this? Through inclusive projects and programs. We support with technical and capital capacity to help poor people access financial services, to expand their opportunities and reduce their vulnerabilities. This explains our partnership with Trimester Save.
When the fintech is fully implemented, it's expected to reduce maternal mortality rates, especially in rural communities, which stands at 319 deaths out of every 100,000 deaths in Ghana. WHO standard is 216 and Ghana is 103 deaths away from the figure. Sierra Leone has the leading maternal mortality figures, standing at 1,360 deaths out of every 100,000 deaths.
We are talking good health and well-being at the 3-day Joy Business Health and Wellness Trade Show from May 30 to June 1, 2019. Be there on the 30th of May and follow the discussion on leading the charge for a healthcare revolution, research, technology and innovation for sustainable growth. Speakers are Dr. Fowia Mankwa, Director of Medical Services, Focus Hospital, Professor Abraham Kwabna Annan, Director at the Noguchi Medical Research Institute, and Eugene Bwedu, Head of Corporate Affairs at M-Pedigree. Special guest speaker is Mrs. Mimi Delis Dako, CEO, Food and Drugs Authority, and guest of honor is the Minister for Health, Kwekwajiman Menu. The Joy Business Health and Wellness Trade Show is supported by New Crystal Health Services Limited, growing together in good health. Health Link Healthy Man and Woman from Pharma Trust Limited, East Cantonment Pharmacy Limited, quality service, simply delivered, and also endorsed by the Ministry of Health. Don't forget to hashtag JoyBusinessHWTS.
The Joy Business Health and Wellness Trade Show opens today at the National Theatre. The theme that we're working for today is good health, a driver for sustainable development. And the conversation that we're about to have, a bit of which you have seen in that feature with Dr. Elvis Kumar-Forsing, CEO of Service Hub Limited, as part of a bigger conversation at the National Theatre today, tomorrow. So, Doc, let me first of all welcome you to the AM show.
Thank you very much.
Yeah, thank you for being here.
Yeah.
And this is the first time, really, I guess, in preparation for today's conversation, that's when I heard about saving towards pregnancy. But why is that important? Why has it become important for such a project to, first of all, to even come about?
Okay, thank you again, and good morning to your cherished listeners. Saving towards pregnancy or saving during pregnancy is very important. I always like to start from the theory bit of things, and so we learn in the medical schools and in public health, you know, that finance is a determinant of health. What that means is simply if you take two populations and one is better financially than the other, after some time, when you come to measure, you know, their health indicators, you find that those who have better finances end up having better health indicators. And it's just simple that maybe they have better access to nutrition, healthcare services that catch disease early so they don't go into complications and all of that. So finance and health are intricately related. And so in the time of a pregnancy, we know that you can come up against many obstacles financially to getting the right health care. The National Health Insurance does a very great job, and let me reiterate that that is free for every pregnant woman. So every pregnant woman has to be on National Health Insurance. Where we come in is just based on the fact that it's not everything about health that insurance covers. Mere transportation, regular attendance to antenatal care services. You cannot show your, you know, your ID card to the taxi driver, you know, things to do with nutrition, buying the right things for the child, clothing. And then there are other unrelated things like good housing, which impacts on health. All these require finances.
Well, and also the factors is not everybody that is even on the national health.
Yes, but so the idea for us is to drive that, because again, for pregnant women, it's free to get onto the National Health Insurance. So yes, not everyone is on it, but we encourage them to be on it. In fact, being on it would help you get onto our program, because with your card, you can go through KYC easily when you dial your *777# on your mobile phone and you are entering your details.
Okay, so just before you even continue, let me ask, how about people who opt out? I mean, they simply want to be taken care of in specific facilities, so they don't want to be on the insurance.
Well, that's a very interesting market for us as well. And they would even need this product more, because you want to be able to plan and have good money available at the time of delivery. There is also those who are, you know, in private business, and who may lose money if they don't go to work at a particular time. They need to be on admission for 2 or 3 or 5 days. They are also people who can compensate their income by having, you know, these money set aside. Yes. So for all these categories of people, our services are very much suited for them.
I've also heard about people who didn't expect that they will go through cesarean session, but then they get there, the final day comes, and then it has to be an emergency session, and they need money so badly.
Yes, very important. So cesarean sessions are in 2 categories. Those that are elective, that means we plan for them, we know it ahead of time, and so we plan and do an elective procedure. However, there are a category of them who come in, like you've described, as emergency, and you would have costs. You know, you have costs that you have to bear concerning that, and they are a very important category. I think in our documentary, the lady who simply jumped onto this program without need for any much convincing was in that situation. Her baby came 2 weeks earlier than planned, and she didn't have any financial resources for her first child. You know, and she saw this as a very good opportunity to
save towards the future ones that you have. But how much can you realistically save towards these unplanned emergencies, unexpected, not unplanned, but unexpected emergencies?
Yes, again, I think that it's a very interesting question, because in Ghana, our coverage with insurance, in case you didn't opt out, covers a lot of the cost. And so I'll say from a practical experience, when we onboard people, we ask them, especially those who have had a delivery by cesarean section before, that how much do you think you need to save? And by experience, they come and tell us that we think we need to save 1,000 Ghana cedis from where they are. Depending on where they are. Other places, we need to save 400 Ghana cedis.
Okay. Well, what's the average?
The average is about 700 Ghana cedis.
Okay.
And this is not, you know, health insurance covered. If you don't have health insurance, you know, then you could be going up to 3,000, 4,000, or even 5,000 Ghana cedis in some private facilities.
I have heard somebody detained, and the cost, I think, was like 3,000. Husband was going around asking friends for support, because otherwise then the wife would continue to be in the facility.
Yes, so it's very true, it happens. And so you have to be prepared, you know, to have this child. Additional dynamic is that once the child comes out, you have additional costs, you know, mouths to feed, and all of that.
But there's some children who are even born sick.
That's
from
even
the
more
very beginning.
That's even more precarious, you know. So even in some government facilities, if you need to go to ICU as a mother, so mother can be sick, baby can be sick, you know, you need ICU, you may need to have 2,000 Ghana cedis to pay for 10 days, because 1 day is about 200 Ghana cedis, you know. And if you have, you know, to have your child in the neonatal and intensive care unit, you would incur costs as well. And all of this require money, and you don't want to be desperate at that time. You don't want to be desperate.
So what's the practice? How does it work on the ground?
So on the ground, right now it's been made even more accessible. Today we'll be talking about technology, and technology has helped a lot. So across every part of Ghana, once you have a mobile phone and you are connected to a network, you just press *777#. If you press
can I do it right now?
You can do it right now. So, you know, *777#.
Yeah.
When you enter it, you would see the third option says Quick Try Save. When you click on that,
Quick Try Save accounts. Okay, that's option
number
3.
Excellent. You know, then you can go through the process.
So what am I doing? Am I beginning the process
yourself? Yes, definitely.
Saving towards pregnancy?
Yes.
Oh, that's scary. Okay, so the option is new customer, existing Pan-African. So I'm definitely a new customer.
Yeah.
Okay.
You know, so you just go through the process and enter a valid ID card. Sitting where you are, you can start saving, connect, you know, transfer money from your mobile money account into. So that's important.
Just like that?
Just like that.
Oh.
It's a plan. You take control of your financial life with regards to, you know, health.
Okay.
You know, and I think with our trade show this 2 days, we are talking about in vitro fertilization technology to do with, you know, having babies. So if, you know, you're even in an infertility mode or stage of your life, so we have primary infertility, which is not had a baby before, or you've had a baby before and you now want to have a second baby and it's taking too long, that's secondary infertility. Many people know it's going to cost money. So why don't you start saving now? So you don't need to have a pregnancy in your womb to start a program, to start, you know, on this service. Fantastic. You can start saving and you can start accessing the healthcare service that you need.
Okay. And how much do you have to save at any point in time?
It's absolutely, entirely up to you.
Okay.
You can choose to save. That's why we say on our physical onboarding sessions, we try to get information from those who are experienced in having babies, and they tell us we want to save 400, 1,000 Ghana. If you are going in for some treatment, that's special, or you want to kind of protect yourself, a self-insurance against, ICU care and all of that, you can set a target of 2,000 Ghana,
Okay.
2,500. And the truth is, you have time. Even if you are pregnant now, you probably have 6 months, depending on the time of your pregnancy. And when you divide the cost across the month, so on the platform, you set 3 monthly targets. That's where Trimester comes from.
Okay.
And you save incrementally to achieve those targets.
Okay.
So it's entirely up to you, but there are advisors, and indeed some of it is inbuilt. So as you register, you set a target and you try and challenge yourself to meet that target.
So are you making profit on what you're saving?
Yes, you are making profit on what you are saving. The current offering we have from our partner, Pan-African Savings and Loans, of the EcoBank Group, is up to 10% interest on what you are saving. We are yet to implement among the poor group savings where they can pool their resources together and attract even more interest. And what we haven't mentioned yet is that in case you have a consistent saving pattern and you need a loan, maybe you haven't hit your target, but you need a loan for an emergency, there's an inbuilt credit scoring system that can make you get access to the money that you need at a point in time, and then just continue, saving to pay back the amount of money that you need.
Okay.
So that's the arrangement.
Is it difficult getting your money back?
Absolutely not. So the idea here, and what we advise a lot of people to do, is to get your primary account on your that's mobile money account.
Okay.
And you can push money into the savings program from your mobile money account. When you need it, you just withdraw from the savings program into your mobile money account. It's very simple.
Okay.
So you do not have you don't have to walk to any banking hall. Setting up, you didn't have to go to a banking hall. Why should you need to go when you are withdrawing? No, you just go in there, withdraw back into your mobile money wallet, and you are good to go.
Interesting.
Yeah.
This is very innovative. How
Thank
many
you.
people are on the scheme so far?
Yes, so we've grown from a year 70, and now we've crossed 1,000 in this year of Mother's Day. Sorry, in this month of Mother's Day. It's very interesting.
1,000 clients?
Yes.
Oh, that's incredible.
Individual.
That's incredible.
Clients. Yeah.
Wow. What has been the success stories, or let me even take success out, what have been the stories that you heard people share?
Yes, so maybe I should just tell a story from where you talked about availability of cash. So this lady who was saving money, and then she reported to the hospital one day. I don't know which hospital, but she said that at that point in time, her husband had traveled and she didn't have access to any money. So she simply went back, took money out of her savings account to do an emergency scan that she had to do privately, and she was able to access the healthcare that she needed. So that, for me, it's a success story, because it's not just about taking money, it's about making it available when the need arises. And we have a number of other stories that have shown that they probably do not necessarily categorize themselves as poor, but they need a management system to say, I'm putting this money away for a specific purpose. That's where most of the story comes from, the success stories come from. And indeed, when we've gone on to talk about, for those who haven't needed to use the money, they said, oh, as for money, it's always useful.
Yeah.
If we don't use it when we deliver,
to pay school fees.
we could use it to pay school fees, we could use it to, do our naming ceremony, if it's really there. So there is really no hindrance or no reason why you shouldn't save, towards birth. And that's what it's been.
So this is an idea that was birthed where?
This is an idea that was birthed maybe over 24 to 48 hours, and the first hour was about 2 a.m. When I was standing on the labor ward, and a woman came in there, brought in by a friend, no link to anyone. She herself had no money, and the midwife was stuck. She was also stuck, and at 2 a.m. you have to get the the system of support in the hospital, social support running. And trust me, that is not easy, you know. And the idea was, why did you have all this time to plan for something like this and you couldn't, you know, do it? We are sure you spent money over the period. And that's where this was birthed. So I said it started at 2 a.m., but in the morning, as I sat in my armchair, I realized that maybe I should do something about it instead of complaining.
Okay.
And so I wrote up the idea, spoke to the United Nations Capital Development Fund. They were very excited. Eventually spoke to the number of financial institutions. The financial institution partner, Pan-African Savings, accepted us through their CSR program.
Okay.
We are glad that now it seems to be sustainable, and so it's running as a full service.
Nice. I'm glad as well. So where are people educated on this? I mean, what kind of places do you do the advocacy?
Yes, so in Ghana right now, we've got letters of introduction from the Ghana Health Service, and so we've been able to go to antenatal clinics.
Okay.
You know, there is a waiting time between when they report and when they see a doctor. There they are educated on various aspects of pregnancy, including the emergency signs, like if you start bleeding, go to the hospital. Then in the curriculum, there's something about financial birth preparedness. Hitherto, the midwives would be stuck and just say, you are going to have a baby, make sure you're ready financially.
Nobody talked to me. No, but nobody even said that to me. Nobody said.
Or they completely, you know, avoid the subject.
Yeah.
You know, so this is a solution that indeed the Greater Accra Regional Director of Ghana Health Service at the time said was a good answer, you know, to that gap in knowledge and practice in the antenatal
So that
care
will be
system.
Dr. Linda Vanotu.
Precisely.
I know.
She's very passionate.
Yes.
You know, so we go in there at the antenatal clinics and take that slot, introduce the program, talk about financial literacy, and also give them this practical tool. You can start today sitting right where you are.
Yeah.
And that has been our primary mode. Like just now, you've been able to type what you had to type in to get started. So it means anybody can do it anywhere in Ghana. So we are hoping we will improve traction, use social media, and start and doing all of this. And who knows, some people may want to join just to support the cohort. You know, you may not need it personally, but you want to join the pool and save, so that we can impress on more partners to be part of this excellent project.
Fantastic. But now I want to take you off from the projects, but still stay with the idea, since the idea came from you. There are other people who probably, I don't want to say don't have phones, but don't want to do it the way that is you are presenting it now, but they want to have a way of saving. Are there other means or other ways of doing it your own way, your own small little way?
Definitely. So this is a solution that we want to give ready-made to people. But there's a whole social aspect, financial literacy and planning. So if you have your own little way of saving, you can do that. And you can make sure that you plan with your significant other to put money aside, you know, for this project. There are some insurance packages available, depending on where you are on the economic ladder, that you can access. But by all means, please think of finances when you're going to have a child.
Okay. All right. What should people expect? You're moderating a session this morning at the National Theatre. Yeah.
Yes, I'm very excited about that. So we are going to talk about leading the charge, you know, in research, technology, and innovation. I want everyone who is interested in the field, and probably not even interested, you may win your interest as you come in to listen. What you should expect is I will come as a panelist with ways in which we can use research technology to impact, you know, healthcare on the ground at what we will call the last mile. So your solutions should be able to get to the last mile. That is the person who is most remote to your solution, either geographically or economically. I will be coming as a panelist. Sorry to sound a bit aggressive, but what I want to do is to impress on people that we will be having a true conversation and trying to get the panelists to tell us what we can do innovatively, which is the last bit of it, because innovation is actually a combination of invention and commercialization. So you can invent in the lab, you can invent through research, but we call it innovation when it has found a place in the market and is sustainable. You know, and the last part of the conversation or the title, sorry, is for sustainable growth. And indeed, on a broader scale, I'll be seeing how we can put Ghana as, you know, a leader in tourism. We've overtaken South Africa in gold production. Why not in health delivery? And, you know, and Ghana is a leader in West Africa, and South Africa is also a leader. And I think that if we put our research, technology, and innovation in place, with the Continental Free Trade Agreement kicking in very soon, Ghana should be placed to make a lot of income from health and be good to our neighbors in West Africa as well.
And I'm sure once people get the background in terms of your own innovation and how you've made it to be sustainable, then, you know, it can also encourage people to come up with their own ideas.
Great, yes. It's not just about talk. We are practicing it, so people will be encouraged to do something.
So we will see you on stage later this morning, and it's all about the Joy Business Health and Wellness Trade Show, which is happening today and tomorrow at the National Theatre. Theme is Good Health, a driver for sustainable development. And I'll tell you who else is going to be there at the National Theatre. There's going to be another conversation, Ghana, a pharmaceutical hub in West Africa, the FDA initiatives, the reality and the potential. And the guest, the special guest speaker for this is Mrs. Mimi Delis, who is Chief Executive Officer of the Food and Drugs Authority. The Health Minister is going to be there this morning. There's also going to be a topic leading that. Okay, that's the topic that Dr. Kumais will deal with. And then we've got many conversations. You don't want to be a part. You don't want to miss it. You want to be definitely a part of it. So be at the National Theatre. It's opening at 10:30 this morning. So Doc, thank you so much for being here.
Thank you for having me.
Thank you for teaching us. And I know that a lot of people out there have also learned a lot. So Dr. Elvis Kumaforsen, CEO, Service Hub Limited. Do you still wear the doctor's jacket?
Yes, in private practice.
Okay.
Yes,
all right.
I have to keep my foot in.
Yeah, definitely. Okay, now before we bring you some show business, we bring you stories on why you need to work out and stay healthy, and then why you have to be at the National Theatre at 10:30 today. Okay, thank you.